Hi, this is Dr. Susan Block. You're on the air.
Hello, Dr. Susan Block.
Hi.
I just finished watching your show, my wife and I.
And what's your name?
This is Terrence.
Terrence. And your wife's name?
Star.
Star. Ooh, how sparkly. And you just finished watching the show, and?
Yeah, actually, we want to know how we could come down and be a part of the audience.
Oh, well, that is a possibility. Sometimes I do invite callers to Dr. Susie's Speakeasy at the Villa Piacere.
Yeah.
So tell me a little bit about yourselves.
Well, I'm a musician.
Oh, well, that's always sexy. What do you play?
I play guitar and keyboards and sing a little bit.
Oh, so you really know how to strum.
Yes, I do know how to strum.
Uh-huh. And you sing? Really?
Yeah, I do sing a little bit.
A little bit.
Mm-hmm.
Not much.
Well, I don't like to sing that much. I like to play it more.
You like to play?
Uh-huh.
So if I invited you over, would you play something for me?
Sure, I could do that.
Yeah? Would you do that? Play
Yeah.
something just for me?
Something just for you.
Oh.
Something sweet and sultry.
Ooh, sweet and sultry. I love it. All right. So that's a great talent. And how about your lovely wife, Star, the star of your life?
Yeah,
Tell me about her.
She's a very attractive woman. She's very sensual, very sexy. Let's see. We were exploring some different avenues of our sexuality, and we got interested in watching your show, and we liked it, and we just thought maybe we had to come out and see something interesting and different.
You want to drive up my avenue?
Drive up your avenue.
Yes. Well, tell me about some of these avenues that you've been exploring, you and Star.
Well, a lot of it is being more open and freer about our sexual desires.
Uh-huh.
A lot of the interesting aspects of sharing fantasies, sharing past histories, things we've done.
Really? I see. That's always a good idea, yes, to talk about the past, to bring up the memories of erotic things that you've done, to get yourselves excited again. How long have you two been together?
It's been about 5 years now.
Oh, well, that's great. And so tell me one of the fantasies that you two have been discussing.
Let's see. One of the fantasies is she would like to watch me with someone else.
Lucky you, I think. Usually.
Well,
wow.
We haven't done it yet. It's just something she's actually just kind of spoken about in one of her fantasies, and
I see.
she never has any particular person in mind. It's just the scenario, I guess, is just me being with someone else.
Is this a male or a female?
With a female.
Uh-huh. Okay. Well.
And let's see, usually in her fantasy is one of two or three things, and one of them that she likes is like it's a nurse examining me.
A nurse examining you?
A nurse.
Really?
And
wow. With a
there,
stethoscope? With her
stethoscope, with the white uniform.
Uh-huh.
I guess I'm on an examining table, and I'm in my hospital robe, and all of a sudden things begin to get a little more personal and intimate.
Yes.
In the course of the examination.
She gives you a urological examination? Does she examine your penile possibilities?
I would say she does that.
Mm-hmm.
And then it goes on to perhaps using that as a thermometer.
As a thermometer to take her temperature.
To take her temperature.
I see. This nurse needs to have her own temperature taken. Oh, yes. Does she take it orally or vaginally?
First orally.
Uh-huh, of course. First orally.
First that, and then after that, then it becomes vaginally, and then all of a sudden I think things just take off from there, and we strip our pretense down. And
sounds like you've already kind of stripped a few of the pretenses down with this vaginal examination with the penis as a thermometer.
Well, I guess what happens is the way she explains it to me, at that point, I take her from behind, take the nurse from behind, lift up her outfit, I guess.
Oh, yes.
Take her from behind, and then it begins to be a wild time.
And do you take her temperature anally as well?
Do I take her temperature anally? I don't have a problem with that.
Now, whose fantasy is this? This is your wife's
This
fantasy,
is her
Star? This
fantasy.
is not yours.
This is hers.
Well,
She
you
told me
describe
this.
it with such, passion and sensual detail. It sounds like it's certainly something that agrees with you, if not your fantasy.
Well, yeah, I agree with it. It's
Yeah.
something I wouldn't mind trying.
I see. Now, if Star wants to come over here to the villa and realize this fantasy, well, I don't know if she's going to realize that fantasy. Do we have any nurses here tonight? Well, you never know. But I want to hear from Star. I want to talk to her.
Okay, hold on.
Is that okay?
Yeah,
Can I talk to her?
She's right here. Hold on.
Oh, good.
Hello.
Hi, Star.
Hi, is this Dr. Susan?
That's correct.
Oh, he wasn't joking around, huh?
Oh, no. This is no fantasy. This is the real thing.
Oh,
You
I'm
bet.
a little surprised. I thought he may have been messing with me.
Oh, well, you saw the show, right?
Uh-huh, we were watching it.
And you saw him dial the number, and
I-
you thought he wasn't really talking to someone? Wow.
Yeah, because you know why? Because he just called to, because we were saying, on your credits it says that you can, did
You can
get that
call.
page?
I have it now.
Okay.
Oh, gosh, here we have both of you, Terrence and Star.
So we were just trying to see how to be a part of your audience, and then I thought from there you may have just been joking with me. It's
Well,
good to
no,
talk with you.
he this is no joke, although we're having lots of fun
Yeah.
talking about your fantasy, Star.
Oh yeah.
To
That's
see
one
t-
of my favorites.
To see Terrence in a hospital gown, all opened up on a examination table, being examined by a beautiful nurse,
Yes.
and using his penis as a thermometer in all of her orifices.
Yeah, isn't that a shame?
No, well, I don't, not for Terrence, no.
Yeah, it's one of those full-breasted women like you were talking about tonight.
Oh, so the show you watched, I was getting into large memories.
Yeah.
Mm-hmm. Actually, I might have one of those full-breasted women here tonight.
Oh,
No,
really?
she's not coming tonight. She was here last week. Michelle, who also called like you and got an invitation to the villa. Well, now, I can't guarantee nurses or mammaries of particular sizes or anything, but I could invite you to the villa.
That would be so cool.
Yeah? You'd like to come over here?
Yeah. we
Yeah,
would.
just to, to check out the show, and we can check you guys out.
That would be good.
That would be fun.
Would you enjoy us checking you out?
Of course.
Yeah. Do you have another fantasy that you'd like to talk about? Something a little more general, maybe?
A little more general.
Well, the nurse thing is so specific.
Oh, okay. I think about him having oral sex with another woman sometimes.
So you really do like the idea of watching him have sex with another woman, nurse
Uh-huh.
or anything?
I do.
Uh-huh. And that the woman is giving him head, or that he's giving her head?
In this one, he's giving her head.
He's giving her head. But you sometimes think about her giving him head.
Yes,
Uh-huh.
both ways.
I see. And you've never seen him with another woman before?
No, I haven't.
We've talked about that, but we haven't actually done anything with that yet.
Really?
We
And
figure maybe it's part of our future sometime down the line.
yeah.
I just wanted to make sure that, he and I are really have our game together, because you hate to get into a situation like that and then lose each other.
Oh, of course, darling. No, I think you're very wise to really solidify your relationship and consolidate the trust and the understanding of each other, so that if you do get into an adventure like this, which does have its risks for sure, you have more of a safety net. That is the love that you've developed over the 5 years that you've been together.
Yeah.
It's been 5 years, right?
Yeah.
So, you think you're really ready for this?
I don't think we're quite ready yet. I'm probably not quite as secure as T is yet. I think he's pretty secure about it.
Uh-huh.
I'm not quite there yet.
And what is your fear exactly?
I think part of the fear is that he'll really love it and then he won't want to be with me anymore.
I keep telling her that's not the case.
Yeah. Well, that's good that you tell her that, because that better be true. And of course, the problem is that you haven't done it yet. So she's going, yeah.
Right.
Right. He hasn't. But he's been with other women before, right?
Yes. Before,
And
you mean since we've been together? Or
no. Before you got together.
Yeah.
Oh, yes.
He'd been with other women.
Oh, yes, definitely.
And do you think that he thinks you're the best star? Do you think he thinks you're the star of his whole show?
I believe that he thinks I'm the star of his show now, but I don't think I'm the best sexual partner that he's had. Yeah.
Is that true, Terrence?
Is that true?
Yeah.
It's kind of true on some levels, but like I keep telling her, it's in our situation. What's more important to me is that it's a whole total relationship. It's not. There is a difference between good sex and a good relationship, and I realize that we actually have a much better relationship than I've ever had before.
Cool. Well, yeah, Star, of course, sometimes you have sex with people and it's the wildest, greatest sex, and this person, though, is just not for you. You're not compatible in other more important ways, or at least equally important ways.
That's true.
And maybe Terrence has found that that's true, that he's been with some women that he's had some really hot nights with, and maybe almost, this is going to sound strange, but sometimes eroticism is ignited by negativity, by knowing that this woman is not for you.
Oh, that's interesting.
Sometimes that's the way it is.
Yeah.
You get really hot because of just the friction. Sex is friction. And sometimes, what happens with a lot of couples who love each other tremendously is that, you feel so fulfilled and so good and so perfect that there's no friction. So you get excited by the idea of being with someone that you're not supposed to be with. Now, this is all very dangerous, and most couples should stay away from it, because as Star is afraid of, sometimes you don't understand that, and if you get your penis sucked by a woman who does a great job of it, and you're not very aware, you're not very conscious, you might just go, wow, that's a hot woman, and you want to be with her more and not be with Star.
Right. And I think the fact that I have been with enough people to really be able to tell the difference between good sex and a good relationship, and this is something that just from my experience, I just know that no matter what I've had in the past, it still doesn't measure up to what I have in this relationship with her.
Wow, Star.
That's what I'm secure about.
Star. I'll tell you one thing, he talks a good game.
Yeah.
I mean, you never know. You never know. Just like when you go out in a car, you never know if you're going to be in an accident because the other driver isn't driving well. I mean, but your man sounds like he is very committed to you.
Yes, I really feel that with him. We've definitely been through a lot together.
Okay, well, you guys can come over, and I promise you nobody will suck his cock.